Assalamu alaikum and a very good morning everyone. Just imagine you have beautifully put a dermal filler in the nasolabial fold of your patient and the patient is very happy with the immediate results. But few days later, a large abscess occupies this area. We all are very keen in learning new advancements in new skills in aesthetic dermatology, but this is the stark reality of what happens when principles of infection prevention and control or IPC are not prioritized. Let's delve deep into the principles of IPC so that we can prevent such complications. A brief introduction, I'm Dr. Kiran Irfan. I'm a proud graduate of King Edward Medical University, did my post-graduation from Mayo Hospital, and now working at Aesthetics Lab with this beautiful team. Aesthetics Lab is basically a chain of hyper-scalable, tech-enabled medical aesthetic clinics. I have no conflict of interest to declare. So IPC would be discussed under the following headings. You all know that sources of infections can be endogenous or it can be exogenous. Likewise, factors influencing the healthcare-associated infections can be intrinsic, like the decreased immunity of the patient, or extrinsic, like the increased pathogenic potential of the microorganism. Among the most common modes of transmission, the contact transmission can be inhibited by the proper hand hygiene, disinfection and sterilization of the machines, and the prompt disposal of the sharps. Droplet transmission can be inhibited by the proper use of mask, and airborne transmission can be prevented by the proper use of personal protective equipments. Before starting a procedure, physician must ensure that he is wearing clean scrubs, which is laundered daily. Hands should be washed with soap and water in case of visible soiling, but if there is no visible soiling, hand rub is enough. Ideally, patient should visit the clinic without makeup, but if at all he is wearing a makeup, she is wearing a makeup, then it should be cleansed with a mild cleanser, and afterwards it should be disinfected with maybe 70% isopropyl alcohol or chlorhexidine. During the procedure, please ensure that you are utilizing an aseptic technique. Disinfect the treatment room surfaces between the patients, and use of multi-dose vials should be discouraged. But if at all you're using a multi-dose vials, each time it should be entered with a separate syringe and a separate needle. And if at all contamination occurs, then stop, decontaminate your personal protective equipment, and then address the infection. Patients should be thoroughly guided about the risk of infection afterwards, and there is a risk of infection, and he should be given written instructions regarding the aftercare, and no makeup should be allowed for next 24 hours, and hand hygiene should be ensured to prevent the cross infections and cross contamination. After the procedure, you should ensure that the sharps and all the waste is properly disposed. When preparing the botulinum toxin, please use an aseptic method. Counter surface should be cleaned with an aseptic solution. After removing the top of the vial, the rubber stopper should be cleansed with friction and 70% isopropyl alcohol for at least 10 seconds. Then reconstitution should be done very slowly, and after the reconstitution you have to label it, and you have to maintain the record of the time and date of reconstitution. And after the reconstitution, you all know that Botox can be refrigerated at 2 to 8 degrees Celsius, and it should be used within 4 hours, but this is a controversial statement. Different guidelines say differently. Now this is very important. Please, 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 when you are using a dermal filler, think that the needle is going in the patient. What we do is, we prime the needle, we prime the filler, and we remove the excess filler on the top of the needle with a non-sterile gauze. This is a very common practice. Please don't do that. In this way, we are introducing the infection ourselves. The needle or the cannula should be attached in an aseptic method. The syringe should never be used with another patient, and it should never be stored for the future use. Then comes the disinfection and sterilization of the instruments. This involves 3 steps, that is cleaning, disinfection, and sterilization. Cleaning should be done with the water and the detergents, and please visually inspect the serrated edges, the teeth, and the hinges to ensure the cleanliness. Then disinfection can be done with the heat or the chemicals, while for sterilization purposes, moist heat is a preferred method. There are some high frequency hand touch surfaces like the door handles, like the drawers, like the tabletops. They should be cleaned with a 70% isopropyl alcohol, while the low frequency hand touch surfaces like the floor, like the windows, walls, they can be cleaned with the warm water and the mild detergents. Please separate the infectious waste from the non-infectious waste. And whether the waste is produced at the treatment bedside, whether it is produced at the phlebotomy area or any other area where the waste is generated by the doctor or aesthetician or any other person generating the waste.
जिनके क्लिनिक में ये शार्प बिन्स हैं हाथ खड़े करें. Excellent, excellent.
Protection of healthcare workers. It's a very important and essential component of IPC. There should be a pre-employment health assessment and the record should be maintained very properly. The training of the staff should be there regarding the personal hygiene, regarding the principles of IPC and management of the sharp injuries and exposure to any body fluid or any blood. And if at all any sharp injury or any exposure to body fluid occurs, there should be a proper post-exposure prophylaxis and there should be a proper counseling as well. This is the schedule of immunization for healthcare workers. It includes MMR, it includes varicella, hepatitis B, typhoid, influenza and meningococcal vaccines. Sir William Osler said, the good physician treats the disease, the great physician treats the patient who has the disease. Let's become great physicians by following the principles of infection prevention and control. Thank you so much.